Thank you, everyone, for coming this morning. It's great to see such a wide-eyed audience on a Sunday morning, so thank you for joining this morning. So we're talking about this specific section of the conference is about technology within the health system. And I think one of the things that I've seen being from a technology company is that there's certainly a lot of enthusiasm about the solutions, about the role that technology is playing. But what I want to tell you a little bit about this morning is the bigger picture and how we apply the technology rather than just jumping straight into the solutions themselves. You know, one of the things that I think we need to step back as a technology company and say, we have a role to play, but we're not the silver bullet in solving the global health issues. As Maslow had once said, if your solution is a hammer, every problem looks like a nail. And I take that to task every day, that while we have a role to play and technology is literally transforming how we address global health issues, it is one part of the equation. It is not the silver bullet itself. So first, just putting some of the issues that we're facing in global health in context. And there's absolutely, even within the global health sector, an enormous information explosion. And one of the challenges that we faced is actually having the information to make the informed decisions to drive transformational change, not only in preventive health, but also in diagnostics and ultimately in treatment as well. But if you look at this in the broader context, you know, just to see how big is the information explosion, something that I think virtually everyone can relate to in terms of social media. In every 60 seconds, 98,000 tweets, 11 million instant messages. If you take this on the broader scale, 1,800 terabytes of data every minute. So when we then sort of center in and look specifically at health, and we're looking at e-medical records or any particular services or specific curative treatments, we have to look at the information that we're collecting, the information that we need in the broader context of the information explosion. And this is something as well just taken from the World Economic Forum, from their global risk assessment. One of the other things that as a technology company, when we look at the role that we can play to provide better information, better decision making through that access to that information within any specific sector within global health, we also find ourselves stepping back and saying, you need to realize that the information that you're collecting and the decision making has to relate and does relate to so many different issues within the community as well. So if you're looking at HIV testing for infants, how does that relate to other information that you're collecting when the mother is coming into the health clinic? How does that relate even to issues with education, with the quality of water in the community? So many different issues that can play in. And so what we're trying to do is step back and look at what are the overall information needs, what are the overall information flows, and how do we apply this information explosion and how we can harness that that insight to better decision making within specific issues, within specific programs, within global health as well. And what we typically find, and this is especially when we start looking at the innovation that's happening with respect to technology, the focus right now on mobile health technologies and the provision of applications, collection of data, new services that are coming out because of the fact that virtually everyone has a mobile phone or has access to a mobile phone, and the ability to collect information and also provide information, that creates real excitement down to patients, whether it's a patient in New Haven or it's a patient in Nairobi or a patient in the most rural health clinic that you can find. But typically what's happened, what we see when you step back and look at the process, whether it's a technology company, a Ministry of Health, a global health NGO, we tend to be starting with the solution and looking at it from the lens of what is it that we can provide, what is it that we offer in terms of expertise, in terms of a solution, and how can we go and apply that to a particular problem. What we found has been most successful, and I'll show you an example as we go through this, is that you really need to sort of reframe how we address solutions from how we look at the problem in the first place. And looking at the problem, what often gets overlooked is who is the actual client. The work that you're doing as a technology company, as an NGO, as a government, are you looking at the solutions? Are you even defining the problems through the lens of your contribution, or are you looking at it through the lens of the patient as well? And often, we reorder. We start with the solution, then we back into the problem. Who is it addressing, and then what's the broader ecosystem? It doesn't work so well. It's not a very efficient process overall. We believe it's better to start with the client, understand the specific problem that they're encountering that you want to address, and then back to this sense of ecosystem. You absolutely need to be looking at the fact that as a technology company, as the Ministry of Health, or even as a global health NGO, you're not working independently. You're working very much in an ecosystem, many times with other players that are doing comparable, if not duplicative work as yourself. And so in our case, and the example that I'll show you is the work that we're doing with the Ministry of Health in Kenya in treating the testing process for infants, looking at HIV testing. From the mother's point of view, from the infant's point of view, we're looking at the importance of the access to care, the immediacy of getting test results diagnosed and back to the healthcare workers and ultimately to the mothers. We also look, though, at the efficiency of the system in which this is being done. So the permanent health secretary, the health informatics director within the Ministry of Health. Again, starting with the clients, we see the patient, the mother, and the infants that are being diagnosed as the primary client for the work that we're doing. Secondary, but equally important clients for us are the health ministry and the workers within the health ministry. So it's, again, reframing. Instead of looking at what is the solution, what are the technologies that we have that can address the problem, we start with, with the clients themselves. Now, sort of the old school approach when you're addressing technology or any other solution that you're building, as the old adage goes, there's good, cheap, and fast, pick two. And what we've realized is that there's a paradigm shift. It's no longer a case of having choices and only being able to deliver 2 out of the 3. Not only is there a requirement to do all of the above, there's also the ability to do so. Technology plays a role in that. One of our partners, Volans, has been doing some, pardon the pun, breakthrough thinking around breakthrough approaches to problem solving, to innovation, and more broadly, looking at the breakdowns in the economy today. And with breakthrough thinking, we've applied this in how we address problems and how we use technology as a solution within the global health sector, in realizing that, number one, when you start with a frame of collaboration, and I believe that collaboration right now is an overused term. It's something that most organizations, would not argue to the contrary, that they're going to go it alone. But how companies, how NGOs, how governments are collaborating to address these challenges is a very broad spectrum on unilateralism to true multilateralism when we look at collaboration. Secondly, though, working within that ecosystem, technology, I believe, is the glue that is pulling together information from disparate, somewhat siloed streams of work that are taking place today. Being able to sort of pan out and see, as I showed with the World Economic Forum, the interconnectivity of issues within a community, within a nation, and being able to pull those, what today have been disparate streams of information into one holistic view has absolutely been game-changing. But then thirdly, in terms of innovation, and real true innovation is not about taking a particular solution, a technology solution or otherwise, and simply cutting and pasting it into a new sector. Taking mobile phone technology or big data analytics and simply cut and pasting those into the global health sector, but understanding how those technologies, how those solutions can be applied, again, for the specific needs, the specific problems within a particular health ministry, within a particular health system. And so what we've done in terms of what was regarded as a broken process for infant HIV testing. We started with the government, the Ministry of Health in Kenya as the primary client, formed a partnership with the Clinton Health Access Initiative, but through the course of building out and defining the problem, which was samples that were being taken out in rural health clinics, mailed through the postal system into national labs, the turnaround time to get those results back out to the health clinic in the allotted time necessary. It was, in effect, under 30 days was the requirement. It was a broken process. The results simply weren't getting back in a reliable manner, and as a consequence, mothers who were bringing their children in for the testing, but then returning to get the test results, not finding the results there, losing confidence in the system, and then ultimately not coming back into the health clinic. Children that were HIV positive were lost to follow-up because the mothers had lost confidence in the system when the results weren't delivered back in a reliable time. So in looking at that as the problem statement and how can we work with the government and other players to ensure that there is a reliable, almost predictable turnaround time to then carry on with the treatment for HIV positive infants, that was going to take different thinking in terms of how the process was set up. In effect, what we were seeing is that from the national testing centers, results were being printed out on paper, put in an envelope, mailed back, and the check is in the mail, absolutely applied in terms of loss, unreliability of the postal system to get those results back. We looked at the fact that while there wasn't necessarily internet access, there wasn't the ability to even say print out the results at local health clinics if results were to be emailed back. There was some very fundamental innovation that could be done using very simple technologies, SMSing the results back where there was a reliable cellular network, SMSing the results back to the local health clinics, printing them out on battery-operated SMS-enabled printers in the local health clinics. So even in terms of needing to rely on reliable electrical grids, not an issue. Looking at technology and some very innovative technologies through a very different lens, starting with what the problem was and what the environmental situation was. But I think more importantly, in terms of decision-making and use of information even at the national level, what we were finding is that you would go into records rooms with reams of paper, sitting unfiled of results that were collected, but information that was never used. When we started and we were asking questions of what information was coming in, how many tests were actually being done, what was the turnaround time for lab results that were going back out into the country, quite effectively there was sort of this shrug of, well, we've done some surveys, we think it's about this. The fact of the matter was the information didn't exist. Today, going through this program, we've been able to digitize information, in effect create real-time results. And today, going from what I would consider sort of 6-month-old survey results of what the turnaround time for test results were, is now available as an online dashboard that any of the health workers in the countries can access. Results are near real time. You can drill down by health district. You can drill down to specific health clinics and know reliably how many tests have been done, how many have been rejected, what is the turnaround time for the results. All of this information, bringing it together in one place, looking at this as a holistic information management system for the government, but not just for the administrators, ultimately available to all of the health workers in the country, has created a level of trust and confidence in the system. It's created better decision making for the administrators, while at the same time provided trust in the system with the mothers and the families who are relying on the systems as well. And to the point of collaboration, and again realizing that there's an opportunity for so many different individuals and organizations to contribute, One of, I believe, the proudest achievements that we've realized in doing this work with the government is that rather than bringing in outside resources to design, in this case, this system, we also partnered with the local university, Strathmore University, whose students actually designed the system and now maintain that system, and it was done at a fraction of the cost of what outside, quote-unquote, expert resources from, say, Silicon Valley or elsewhere, might have been able to do. And when we sat down with the health minister and described that, notwithstanding the transformation of the information available to make better decisions, at the policy level, the fact that we were able to involve students, create real-world opportunities while they're in school, but ultimately then employment opportunities to grow and maintain this system and expand it beyond the HIV testing to a much broader health analytics system for the government. That fact alone was the game changer in terms of the collaboration with the government. So as I sort of step back and look at our role as a technology company and what we can bring in terms of innovation and breakthrough through the use of information, through the use of technology within the global health sector, we realize that it's not the technology itself. This isn't a silver bullet and we're not parachuting in with all of the answers. It's very important to step back, understand who is your client, the patients that you're ultimately serving, the patients and the citizens that the governments who are actually your core clients are serving. You have to start and look through their lens of what is the experience that they're having, what is the problem that they're encountering, and then what is the ecosystem that you're working in. Technology becomes one cog in the wheel. It's one gear in driving this transformational change. It is absolutely critical to bring about the change that we envision within the global health sector, but you really do need to step back and look at the broader ecosystem. For us, collaboration is about bringing our expertise, our knowledge of technology, but working in a very collaborative way and realizing that we have a contribution, but it's part of a much bigger system in which we're operating. Thank you.